Well, good afternoon, everyone. My name is Amal Nirgodkar. I'm the CEO of Patient Prism, and I'm delighted to welcome one of my friends here from Smile Brands, one of my favorite DSOs, Jody Martin, who is their Chief Marketing Officer. And we all love Smile Brands. We know that, and what they've done across the country in terms of really motivating dental practices to do more than just dentistry. And part of what they've done is Smiles for Everyone Foundation, which Judy also oversees. And Jody is responsible really for marketing, public relations, and call center operations for this big group now. I'm not sure how many offices, over 400 across many states. Jody Martin, welcome to our program.
It's great to be here. Thanks for having me.
And we're always excited in the DSO world, in the dentistry world, of what Smile Brands is doing, right? Because I think you guys have laid the path for many organizations to follow, and obviously we're in the middle of this pandemic. It seems that we were closed in March and April, and things have started opening back up all over the country. There's really good news about the demand side of things, and things are really looking good. And I know many of your practices were open during the close down for urgent dental care. But now that most practices, I'm assuming, are open, I'm not sure some states, what are some of the challenges that you've seen that you've had to overcome as practices have started operating again?
Okay. Well, as our CEO, Steve Bilt, likes to say, this is our first pandemic as a company, and so we didn't have an off-the-shelf playbook for how to market our way through this challenge, but so far so good, I guess. So the when this first hit, the focus was really around shutting down locations and notifying patients of which locations were open so that we could take care of their emergency and essential care. We like to say it's a lot easier to go down the canyon wall than climb out. And so when it came time to start reopening, there's any number of challenges. So, the first I think that's worth talking about is really the internal challenge. So getting employees who had been furloughed. At one point we had furloughed, over half of our employees, and that we had to convince them that it was safe to return. So we spent a whole lot of effort really on our own internal protocols, making sure we felt it was safe to return. So, it's not just, a marketer's view of what's safe, it's a clinical view of what's safe, and creating both the protocols and the training tools to help people re-engage in the business. So, so that was job one. And in the safety reassurance for our employees was very similar to what was required for patients as well. So we knew that getting patients back into the office for something other than an emergency, I mean, if you've got an emergency, you're going to come in because you really have no choice, you're in pain. But to get patients in for non-emergent care, we needed to have a reassurance that it would be safe. So, so we created a number of different communication tools and really spent the first part of our reemergence communicating the safety message in social media to all our current customers via text and email, and then in all of our new patient communications as well. So that was kind of job one. Also, as we started preparing from a marketing perspective, we prioritized our current patients and in the backlog of care that had built up as our offices were either closed or on restricted hours. And so we did a lot of outreach to patients that to let them know we were back open. I mean, things as basic as giant vinyl banners outside of our locations, as that, as well as phone calls and emails and texts to let everybody know that we're back open. And then more specifically around people who had appointments on the books that had been canceled, getting them back in, and people who had treatment needs diagnosed prior to the crisis, making sure they were on the schedule to come back.
Right. I mean, one of the things you talked about as preparing for this interview last week, we had talked about the importance of now that you have people coming in, we can't see the same number of patients as we used to see before. Even there's restrictions how many people can be in a room. So the mindset has shifted to, we need to do more same-day dental care. What did you guys shift to that mindset, and what specific steps did you take in terms of getting the patients into that mindset?
Well, a lot of this happened organically during the crisis. So all those teams that kept their offices open and were treating patients throughout the crisis, it was by necessity the same day care. I mean, nearly every patient that they were seeing was in pain. The goal is to get those patients out of pain and to do as much dentistry as possible while they're in the office so that they can limit exposure of coming back. So it's both the humanitarian thing to do to get them out of pain, as well as the COVID security thing of not having to leave their home multiple times to get a dental issue taken care of. So that, there was very little sort of training or convincing that needed to be done during that period of time, and there were lower volumes. Therefore, it was easy to do more same day care. As the business has picked up, and now we're over 90% of our normal patient flow, the figuring that out and maintaining some of that of what we've learned is the key. And we have been we know that still patients who leave their homes aren't thrilled about it. So the most people that when they walk in the office are, would rather not be in a healthcare setting right now because there are concerns. And so it still remains a very high priority to get as much care done when they're in the office versus asking them to come back and feel at risk another time.
So the question is, dentistry has always enjoyed a decent work week. I mean, 4 days, sometimes 3.5 days. I mean, is that over now? Are we going to have to expand working hours, more hours during the week and maybe weekends? What did you guys do with that? Because obviously there's no way we can see the same number of patients given the restrictions.
Yeah. Well, our model has really never been built around a shortened work week. Our offices tend to be open 5 to 6 days a week and with some extended hours, because our whole model is really about a more retail-oriented model and really about customer convenience. So for us, it's not a huge leap, but we have a high volume of patients that come through our offices, and so to see the same volume with the limited, while still doing the social distancing that needs to be done, is difficult. So we have certain paths through the office that people have to follow, and when people come to check in, we do the screening and temperature checks and then ask that they wait in their cars. And so there are lots of things that are going on to try to maintain the social distances, but then spreading out appointments over a greater number of hours is the last thing that also needs to be done.
What's the psychology of teams? I mean, yes, you can do this for a little bit of time, but it does get frustrating, right? Just wearing all this stuff, the mask and the gowns and the shields. What are you seeing from team members across all the offices?
It's a very difficult and stressful time for our teams, both in terms of the physical discomfort of what they're going through with all those layers of PPE, and the heightened concern and nervousness of the patients. You get it's a bit of a tinderbox, and so we've spent a lot of time and effort around the mental health of our employee base and trying to coach about things they can do to avoid burnout. And it's a very serious consideration. One thing that's been high on our list this week is all the resurgence we're seeing. I mean, it
Right.
is
Right.
really, I'm sure you feel the same way. It's like, oh, this can't be happening again. And so
Absolutely.
it's very sad when people had in their mindset that this was behind us, and it's so clearly not behind us. You know,
Right.
from the start, one of the things that Steve was coaching on is this concept of tragic optimism.
Mm.
And this term tragic optimism was developed by a psychiatrist and Holocaust survivor that basically said that the people who thrived and managed to get through tough, horrible situations like the Holocaust were ones that could find something to some meaning or happiness in the current moment versus
Correct.
just counting on when that horrible thing was going to end. Because if you're just focused on the end date, you're going to get more and more depressed as the end date moves out. And so we've been trying to help our teams focus on the wins, the day to day, and not focus on when this is going to be over, because it's going to be quite a long time before it's over.
I mean, our team members, if they have some psychological concerns, are you guys providing some support? They can call anywhere to kind of voice their concerns, or does it happen through your regionals, or how does that
I
function?
mean, we've got our full field support organization. We have also corporate resources for people that are feeling uncomfortable. And yeah, and we're rolling out a whole nother program, you know, in addition, of course, to the safety concerns and all the
Right.
physical discomfort that comes along with COVID. You've got the social unrest that we're seeing right now as well, and that's got people on edge, and it has patients on edge. So patients come in with a level of fear and anxiety and perhaps chip on their shoulder that they didn't have before. And
Right.
so dealing with patients, making patients happy is even harder than usual.
So in light of this, I mean, my God, that's a lot, right? We covered like a tons of stuff, Rob, about opening this stuff. But let's put your marketing hat back on, because you run marketing, and so what kind of marketing strategies are you even deploying right now with offices?
So when we, you know, at the height of the crisis, we turned all paid marketing off. And then when we started to see a turnaround and reopen our offices, we wanted to make sure that as we reopened, they filled up, of course. So so we restarted very cautiously our marketing activities, sort of on an office by office basis, based on the number of open hours and the number of patients that they were seeing. And when an office was ready, we would start messaging in you know, both digital media and postcards, and we've been doing social media and that sort of thing all along, but to drive patient flow in.
Right.
Little different than how it was before the crisis. I mean, the focus right now of all our communications is the messaging is more around safety and in kind of the now more than ever, it's really important to take care of your health. And I think we're seeing that. So, you know, when we started our marketing efforts, it was a very cautious approach. And we're like, well, we're going to watch it. Certain thing, digital media, you can decide really quickly if it's working or not.
Right.
And we were surprised to see that it was working even better than pre-COVID.
Right. Right.
So some of that is because we were going against emergency dentistry terms, and when we started, there were still a lot of offices closed. But still to this day, our response rates on our marketing is better than what we would have expected. And I think there's a number of factors at play. So there's, you know, right now, many people, I hasten to say most, are still working at home. And so when people that are working at home might have a little more free time to get to the dentist, or, you know, they can adjust their schedules more easily than if they're coming into an office. I think that helps. The stimulus money, or the relief money from the federal government has certainly helped, because there are people that have cash in their pockets. And so the amount of cash paying customers and credit card paying customers is up versus normal. And then the other thing that I mentioned before is, I think right now people don't want to be at risk for COVID and then also be at risk for other health concerns. So I think people get that, oh, not taking care of myself in a pandemic is probably a bad idea.
And I'm sure you guys have had to, I guess, change your communication strategy around the importance of having optimal oral health to maintain that level of immunity, so that you're protecting yourself against any kind of disease, including COVID. So have you changed some training protocols with respect to communication between on the phones as well as in print?
Yeah, I think all our messaging is really less about, here's a deal, come in and get your teeth cleaned, to more about, now more than ever, it's really important to take care of your dental health and the relationship between oral health and full body health.
I think it's important. I think as dentistry, I've said this for a long time, that I think dentistry needs to do a better job at communicating its own importance to the public, because we still need to bring 50% of America back into the dental offices, which never have seen a dentist. And there is so much, I think as an industry, I think we haven't done enough to educate. I think the movement is starting. I think the DSOs are starting to make that movement come across, saying that, hey, taking care of your mouth is going to help everything, including your relationships sometimes, because you need a good smile.
Well, I do think that to that point, though, the industry scored some points, I would say, in this pandemic, in that at the beginning, there were lots of debates around, is dentistry an essential service?
Sure.
And we were out there slugging, trying to make sure everybody understood. And
Right.
when dental patients started arriving in an ER, people get, oh, well, we have nothing to do with those patients. And
Right.
that has become more and more clear across the spectrum of lawmakers and regulators that, yes, indeed, dental is an essential service.
The role of marketing, kind of, especially during crisis time, becomes more than just new patient acquisition. It also becomes communicating the right things to your team, to your doctors, as well as, obviously, you furloughed a lot of people, so some recruiting messages as well as people come back, because that has been a challenge in some states that you operate in, that people are not coming back from being that. So talk to us about other activities that marketing has had to do during this pandemic to ensure proper flow of communication with team members, as well as potential new recruits that you're trying to bring in, because you need to have enough capacity in order to see the patients.
Yeah. Well, communications has been so critical to our success in this time. And we really, just from the day this started, we instituted a nonstop flow, really, of internal communications to make sure everybody was on the same page in terms of the sort of procedural things that need to happen and all the safety messages, but also that we were sharing, coming up with forums for people to express themselves, to show solidarity, etc. So, we have a daily briefing that has all the important messages about what's going on in the company, as well as what's going on in the world relative to this crisis. We have weekly, what started out as twice weekly all hands calls, where Steve and our operating teams and our clinicians talk to the employee base about issues of concern. We started an internal Facebook group where people can have a little fun and showcase things that are going on in their office. We've had a platform in our company for a long time called Celebrate Everyday Miracles, where we we shout out to each other when great things happen. And there's a lot of those miracles being showcased on our Facebook page. And now we're rolling out even another program about making our offices a safe space, both COVID wise as well as, socially, and with the Black Lives Matter movement and everything else that's going on right now. So that's been critical from an internal communications purposes, but in that gets translated. A lot of those things get translated as examples when we're in the recruiting discussions and in talking to doctors that may want to affiliate with us through M&A activity. We've had so many of our providers say during this crisis, I have no idea what I would have done if I had still been in private practice. Correct. During this crisis. And we've created materials for, private dentists to basically build off of some of the resources we created and made those available, because it would be very hard if you had shut down for the months of March and April, and all of a sudden you're starting to reopen and you don't have your safety protocols and you don't have access to PPE, and right. It would have been very, very difficult. So, that's something that our current providers really appreciate, and that everybody we talk to is like, wow, I wish I'd had that throughout the crisis.
Absolutely. And I think that's one of the reasons why I think the DSO industry going forward will be more of an example for dentistry of, like, not everybody needs to go that route, but at least the support system, the infrastructure that's there to help you guide through these times and preserve your way of life and preserve the way you function as a dentist. I think Smile Brands has done an enormous job in ensuring that the mental health, not just the financial health, but the mental health of its team members was intact during this crisis, so that we could come out of it. And that's why one of the reasons why you guys are doing so well coming out of this stuff. Last question, parting things. What have you learned in this crisis over the last 3 months? Because we've never been through this, like Steve said.
Yeah. Well, we've learned that we're more resilient than we might have thought. We've come together as a team in ways that we never had before. We were always a close-knit team, but this has taken it to another level. We've definitely learned there are things that are going on in the field, like heightened levels of same-day care, like how basically how we talk about treatment and the urgency with which we talk about treatment, not as an optional thing, but no, you really need to do this to stay healthy. I think there are things like that we don't want to say the crisis is over. Let's just not do that anymore and treat dentistry as an optional thing.
Correct.
And so some of that, there's a number of things that we've learned during this crisis that are here to stay.
No, I definitely think all of us, including on our side, I think our business models have had to go through rapid evolution to become better, because we had no choice. Right? We had to look internally and say, what could we do better in order to be a better company? See more patients, optimize our schedules, convert more of them to coming in. It's been an amazing journey, and we don't know, as Steve said, right? We don't know what the other side of the canyon looks like, but all we can think about is that hey, we're gonna come out hopefully better on the other side. We don't know. We just don't know what that looks like. So with that in mind, we're all marching along forward. And looking forward to kind of this 2020 year to be over. But I think we're going to come out here stronger. We're going to come out of this stronger, and I think we're going to bring a lot more people into this industry that we didn't see before. Jody, what a pleasure it is to talk to you. And thank you for sharing all your wisdom and all the things that you've done and Smile Brands has done over the course of these months. And we'll continue watching you guys over the next year, and we'll take a lot of inspiration from what you've done.
Well, thank you for having me. It's been an interesting ride throughout this COVID journey, We hope that this next wave doesn't restart the clock, but we're more ready for it than we ever were, I guess.
Absolutely. Thank you so much for spending time with me today.
All right. Thank you.